being affected. Next, we have Carolyn Lewis. Carolyn has spent 2 decades helping to foster community and economic development initiatives and to cultivate strategic partnerships. She currently serves as the Director of Legislative Affairs and Grants at Bassett Healthcare Network. She works to identify and address state and federal legislative issues that impact rural healthcare operations. She advocates for policy changes and tries to secure funding through state and federal grants. Let's see, she represents Otsego County on the Mohawk Valley Regional Economic Development Council and is a board member at Pathfinder Village. Lots of other things too. These people are multi-talented.
Thanks, Stephanie. Good evening. Thank you for hosting this and including me in this presentation. I am Carolyn Lewis. I'm the Director of Legislative Affairs at Bassett, so this is my world. I'm going to go through some more stats, and Stephanie is right. The devil is in the details here, and I do want to also start off by pointing out things that Tanya has said. Tanya specifically kept saying if, and so people, everyone in this room should understand that you have a voice to call your legislators, you have a voice to be talking about this, and just because this bill has passed, there's opportunity to continue to combat some of the cuts that may happen. So I am going to give you a couple of more statistics and try and put this into some perspective. So as Diane said, the Congressional Budget Office has estimated that the federal spending on Medicaid and children's insurance program is up to $1 trillion over the next 10 years. So they anticipate achieving these cuts through work requirements, restrictions on state funding and payments, either directly to hospitals or to other entities, more frequent eligibility requirements, and that's really a key piece to the essential plan participants, and limitations on expansion. And a lot of this has to do with nuances in taxes and how the federal government partners with the states and the county to leverage and deliver the Medicaid dollars. But those are really what's going to drive the cuts, is putting in more work requirements, accelerating eligibility from 90 days to 30 days. So if you can imagine the numbers that we're talking about and the resources available to help people re-enroll and to come up with additional documentation is going to be a challenge, but it's not overcomable. I don't think that's a word. So how that flows, and Diane talked about, so Medicaid is a sharing program between the federal government and the state. The federal government provides about 50% of the funding. The rest falls to the state, and Tammy will tell you how also it falls to the county as well. So of that $1 trillion, New York State is estimating that they will lose $13.5 billion in federal health care funding annually. So at this time, New York has not messaged a formal response to the budget shortfalls that they have to address, in part because a lot of these cuts and requirements are going to be phased in over the next several years. So New York State is going to have to come back, and our local or our state representatives are going to have to make some pretty arduous decisions about how the state funding gets implemented. New York State is a very generous state to Medicaid, and they are committed to helping populations across rural and the urban areas. I just want to take a pause here from a Bassett perspective. It is my job to monitor legislation, not only in this, but ongoing. We are deeply committed to keeping an eye on what is happening. We are in regular communication with our state and federal representatives. We are advocating for Bassett and for our patients. And so we have advocacy agencies and local partners. So we are continuously working on this. Our leadership team is deeply engaged. And Bassett over the past 18 months has spent a lot of time doing some strategic work in making sure that we are sustainable in-house, and that's everything from supply chain to productivity. So we are really trying to maintain and secure our financial position so that we can weather any disruptions. Our primary goal is to take care of our patients. That is our priority, and that is who we are. So and with that being said, we will continue to provide care to everyone regardless of coverage. That is our mission. And so I just want to sort of lay that out there as Bassett understands that there are a lot of concerns out there. There are a lot of questions. There are a lot of unknowns. So we are, actively monitoring this. A little bit more statistics in talking about Bassett. You're probably all pretty aware of us for the most part, but just to give you some numbers, Bassett sees about 244,000 patients annually. We do that across 8 counties that have 5 hospitals, 30 health centers, 22 school-based health centers. So our geographic footprint is essentially the size of Connecticut. So we're in your communities, we are there for you, and we are obviously one of the largest employers, not only in Otsego County, but across the region, and we employ about 4,000 practitioners, caregivers, frontline staff to deliver that care. 26% of our net revenue comes from Medicaid. So it is a substantial piece of our funding. 26% of our emergency department and prime care visits are by Medicaid patients. 76% of our nursing home residents are covered by Medicaid. 60% of our pediatric population is covered by Medicaid. So we do have, and that's not unusual for especially rural entities. About 77% of our total revenue comes between Medicaid and Medicare, Medicare being the largest funder for those services. And again, if you want to talk about statistics, I am more than happy to talk about it another time. So there are, as I had said, there are eligibility restrictions that are going to come into play. There is cost-sharing expenses that are going to come into play for individuals. There may or may not be direct payments to hospitals that are going to get cut, but we are keeping an eye on this. We are managing our finances, and we are really, really committed to making sure that our patients have access to affordable care on time and where you need it. So I'm going to stop there because...
Thank you.